guys, it's Stephanie with Stamford Moms, and I'm here with Dr. Kate Mullin with the New England Institute for Neurology and Headache. And today we're talking about concussions in children because it's something we think about a lot during the summer and in the fall and that sort of thing. And a lot of times we think about it as it relates to sports, but we were just talking and you were saying that it's really something that you have to kind of think about in other parts of play and that sort of thing too.
So, absolutely, sports, school starting, it should be on top of mind, but it should always be in the back of your mind throughout parenting. And while I don't want kids to be bubble wrapped throughout their lives, there's certain things that we can do just to be on the safe side. So baby gates are key. A kid rolling down the stairs is just as likely to get concussed as a kid in a football game. So ways to prevent toddlers. Car seats, making sure that they're the appropriate size. Parents are sometimes upgrading car seats too soon. So kids get out of harnesses before they're ready for boosters. Those can prevent, if they're in the right size car seat, it's installed properly and they're buckled in properly, that can prevent a concussion. So playgrounds, so we were just talking about the different media at the floor of a playground. So if your child falls off the monkey bars or off a swing, if they fall into those rubber mat playgrounds or into sand, a concussion is much less likely than if they fall onto dirt or to concrete. So just making those sort of everyday life decisions can help kids even before they even start thinking about contact sports.
And so at playgrounds, what are some of the things parents should make sure to look for when they take their child to a playground, just to make sure it's safe?
So the biggest hit is usually monkey bars. So I always tell parents, while I'm absolutely playing the monkey bars, I do recommend that they stand close by. Most other things, slides, climbing is usually pretty safe, but if a child swings too high in the monkey bars and their legs get up underneath them, that's when they're most likely to hit their head. So that's the one thing that I say, you should probably helicopter parent a little bit around the monkey bars.
Okay, that's good to know.
Yeah.
And then contact sports.
Right.
What are some things parents should keep in mind when it comes to concussions and contact sports?
So I want everyone to keep in mind that doing contact sports is a choice. It's a decision that families make, and that is, everyone gets their own, factors into that. But no one should feel like their child should be obligated to do contact sports. Should the family decide, child, parents, whoever else is involved in the process, that the child is going to do contact sports, there's some that have a higher risk of concussion than others. So the highest risk sports are football, which I feel like most people sort of gather, soccer, and ice hockey. Not that you can't get concussions in other sports. I've had plenty of girls in field hockey in particular come with concussions because while it is very much a contact sport, they do not have much in the way of protection. So something to keep in mind. And then, so if they do decide, okay, let's do this football, let's say, you want to make sure that their gear is appropriate. So helmets are to standards. They come up with new, better protective helmets. You want to make sure the school provides those, that there's someone at the sidelines should your child look like they maybe suffered a concussion, to do some sideline, just basic testing, because most of us can't be at every game.
Right.
You want to make sure there's somebody there that will act on your behalf and pull your kid from play as if it were you, just to be on the safe side. You want to make sure that the games are refereed appropriately, so there's no foul play, no dirty play, because you're more likely to get concussed if the game gets messy and someone's not really regulating, the safety of the play.
Okay. And then if a child is showing symptoms of concussion, what should you do?
So the first thing you absolutely do is you pull them from play. And I really say you pull them from play until you see a specialist. Because, parents shouldn't be the ones to decide if your child is ready to go back. And that's both for play, but also for school. So one of the biggest mistakes parents make, and it's no fault of their own, but they send them back to school too quickly. And the problem with that is that if your brain isn't ready, that can often actually make your prognosis and make your course to recovery longer. So if you think your child is showing signs, so for example, headaches, dizziness, light sensitivity, irritability and mood swings is a really big one, especially in kids that are younger. They just seem, like they've got a short fuse. That's something to look out for. Insomnia, so sleep patterns get disturbed. So and that doesn't necessarily happen the minute they get hit, but the next day, if your kid seems extra fatigued, they're complaining of a headache, they seem like they're better off in the dark, bring them to see a specialist. So for example, here at the NEINH, we have a concussion center. So if anywhere 4 weeks, it doesn't have to be the next day, although we'd like to see you as soon as possible. Within the fourth week of getting a concussion, we'll bring you in. So our nurse will do some standardized tests just to see if you have any eye movement symptoms, any cognitive symptoms. We do a little test to see what your prognosis is, because there's some risk factors for your prognosis and your recovery taking longer.
Mhm.
Then you see one of the neurologists here, we do a thorough neurologic exam, and then we go through what to do. So we'll do that briefly, and for each patient it's very much individualized and different depending on their symptoms and their history. But we say generally cocoon. So by cocoon I mean you really do sort of isolate yourself for about 48 hours. So no TV, no screen time. You try to sort of limit even chatting with your family at home. You really just remove as much external stimulation as you can. But then after 48 hours, and it used to be hide for a week and then go full back into everything. And we learned that neither one of those things is right in the extremes. 2 days of quiet and then slowly add things back. So you add back a little screen time, you add back a little daylight, you add back a little reading, a little cognitive processing. Then you can slowly add back some physical activity. So going for a walk, becomes jogging, that kind of thing. A child really should not go back into full contact sports and say they've been completely at their baseline for at least 2 weeks. And by that I mean they've added back everything, full days of school, doing gym, without the potential for contact, and nothing makes them feel worse. If they can do that for 2 weeks, then they should be okay to play.
Okay. Anything else you want to add?
So one thing that just the parents should keep in mind is that the degree of injury, so the degree of impact, doesn't always predict the degree of the concussion or the recovery period.
Okay.
So it's not like, oh, they barely got hit, they should feel better by now. There are risk factors for children to have a more prolonged course. On average, concussion, should take roughly to be completely at baseline, about 4 weeks. But there are kids, so if you have a history of ADD or ADHD, if you have a history of anxiety or depression, if you have a history of previous concussions, and if you have a history of headaches, that could be longer. So parents and patients, so the students themselves actually need to be patient with the recovery time, because some people have a reason for it to take longer and that's okay, and rushing it will always make it take longer. So to be patient with your child and to be patient with the process, because their brains will get better, but rushing it because of the stress of school or the stress of just social needs will not make it get better faster.
And that's really good to know, because with something like this, people always ask, how long will it take? How long will it take?
Yeah.
And it really depends on
So we
the
give them
person.
a guideline, just because it's nice to have some sort of goal in mind, but there's a lot of different factors that can move. If you push too hard, too fast, that can make it take longer. So we say roughly 4 weeks, but for X, Y, and Z, it might be longer for you.
And if anyone does suspect that their child has a concussion or anything like that, they can contact NEINH.
Absolutely. The sooner the better, but again, up to 4 weeks, and we'll do immediate testing, same-day testing if we can. Actually, we also do baseline testing, so if your child has never had a concussion, it's really helpful to see what their brain looks like perfectly normal, so that if we do bring you in for an emergent concussion exam, we have something to compare it to.
That's really interesting. When do you recommend parents do something like that?
So really, anytime that they're of age, again, generally when they're about to join any sort of contact sports and there's a worry that they're getting more physical and the sports are getting more competitive, I think it's really wise to bring your child in and just know what their brain looks like perfectly unconcussed, because then our data points moving forward have a lot more reliability because we've got something to compare it to.
That's really great to know. Thank you so much,
You're
Dr.
welcome.
Mullin.
My
It's
pleasure.
always great to talk to you. Thank you guys so much for watching.